Hi, I'm Dr. Vipin Dehane, a maxillofacial surgeon and implantologist. I am working as head of the department in the Department of Dentistry and Maxillofacial Surgery, Fortis Hospital, Mumbai. Today we'll discuss about dental braces or the correction of teeth. There are three phases where we can do correction of your teeth. Number one, during pediatric age group, that is during the mixed dentition period, where we can give a myofunctional appliance to your patient which will correct your jawbone as well as the teeth. Number two, here is your middle age group or the adolescent age group, which start after eruption of all your permanent teeth. In that case, we give a braces that might be a metal or ceramic or the advanced one what we call as an aligners. This will correct your teeth as well as the jawbone and help your smile corrections as well as the alignment of your teeth in the oral cavity. When you do the correction of your teeth, it will create harmony between your TM joint and the occlusion, which will increase your chewing efficiency and also the correction of your smile as well as the facial profile. Almost 30% of the Indian population having the malocclusion with the crowding in the teeth, but they are not corrected because undiagnosed or the patient is not visiting to the dentist. If you find crowding in your teeth, always you have to go to your dentist and do the correction of your teeth as early as possible. There is a myth that we should not extract the teeth for orthodontic correction. No. If there is no space in your oral cavity or the jawbone, you can extract your teeth so that you will get a proper teeth alignment in your jawbone, which will again go for a class 1 malocclusion or the class 1 occlusion for your teeth. Next, if you have a malocclused teeth, it will create tooth mobility or it also create a gum diseases like periodontitis or the gingival bleeding. The most drawback for your malocclusion teeth will create a false smile or the prognatic smile or the gummy smile. So always I advise to go for a orthodontic teeth correction with your dentist with the various modalities which is given by your dentist. Nowadays we have an advanced one, that is the tooth colored aligners, which comes with the different brands, mainly Indian and the internationals. These aligners are almost 40 to 50 sets we give to the patients. They have to change their aligners every 15 days and it's all computer or CAD/CAM guided. So it's all programmed and we can stimulate the normal teeth or the normal smile and change the smile of the patient. Before the aligner treatment, we can educate the patient. Also, we can inform them how their correction will be there after 6 months or 1 year. So this is all program or CAD/CAM guided aligners. So I always advise patients to go for an dental aligners instead of ceramic braces or the metal braces. And my last point or the take home message is always go for an orthodontic teeth corrections because these all corrections are in the physiological limit and this will not damage your teeth or the gums. But with the corrections of your orthodontic teeth or with the corrections with your braces, it will increase your smile, your confidence, your jaw profile and your facial symmetry. Always visit dentist for your smile corrections. Thank you.